Welcome back, everybody, to On the Couch with T. Today, I am delighted to have Dr. Diana Baptiste with us today, and she's going to talk to us about a subject matter that is very interesting to me, and that is autism, particularly with children. So, Diana, if first you could start off by telling us who you are, based on the letters that are behind your name and what you do.
Okay. Well, thank you, Tanya, for the invitation. It's really nice to catch up with you. It's been a while.
Yeah.
So, just a brief introduction about myself. My name is Diana Baptiste, and I'm an assistant professor at the Johns Hopkins University School of Nursing. I'm also a graduate of Johns Hopkins School of Nursing. I earned my Doctor of Nursing Practice degree, which is a practice doctorate, back in 2013. And that's around the time I think I met you a little bit before then when I was still a student. So, long story short, I love to teach. My passion is preparing the next generation of nurses. So I teach in the master's and the D&P programs at Hopkins. I teach across clinicals. I teach, didactic courses. I've been doing that for 13 years. And so that's been really big fulfillment in my life. But first and foremost, before that, I am still a nurse and was a nurse working in the front lines way before, COVID. But I did work as a cardiovascular nurse, which is most of my passion is looking at, taking care of people with cardiovascular conditions, especially looking at cardiovascular conditions like hypertension amongst Black populations. So that's a little bit about me. And professionally, personally, I'm a mother of three children, a wife, um, a daughter, a sister.
I understand you have a son who is special needs, and we're going to talk about that today.
Mhm.
Can you tell me what the diagnosis is exactly?
Most definitely. His diagnosis is very clear. He was diagnosed with autism spectrum disorder, ASD. He got diagnosed at a time where autism was not well known in 1999. And the first diagnosis he got was a very broad diagnosis that doctors would bill for, and it was called pervasive developmental disorder, PDD. And I don't believe this diagnosis or code is still being used today, but 20 something years ago, when they really, if the child was under 3 years old, and they had autistic features, they would just give them the broad diagnosis and say PDD because they were too young to really be diagnosed with autism at that time. But now we know better. Children are being diagnosed with autism spectrum disorder at earlier ages. They took away that guideline of 3 years old. Typically when a child has autism or any type of autism spectrum disorder, whether it's very mild or quite severe, where my son is more on the severe side, it's pretty clear at usually typically about the age of 2. So we don't have to wait till they're 3 years old anymore, which was really frustrating for parents back then, because a difference of a year can feel like a long time when you watch your child decline. I'll give you a little background about my son. So Jalen is, he's now 24 years old, and his name is Jalen Mark Baptiste. And when he was born, I brought him home from the hospital. And, from the time that he came home from the hospital that first night, he never slept. And then moving on until, in his first couple of months of, in infancy, he always seemed to have a problem with sleeping. And I couldn't understand it because he was our second child. And our first child, we were able to get him, situated on a cool sleep schedule. I used to really help a lot with my nieces and nephews. And, we all know that babies have challenges with sleeping sometimes for different reasons, whether it's just like colic or, just some irritability.
Right.
Yeah, but Jalen's lack of sleep was just different. And I just didn't understand what that was back then, but I knew something was different about my baby. And so by the time he was 1 years old, I really started picking up on different things that, just, when you tickle a baby, they smile. You could do that and play with him, but his smile will be delayed. He'll smile a little bit like 30 seconds later or something. And so again, as a mom, I really couldn't put my finger on it, but I knew something was different, and something probably needed to be addressed. It was very difficult getting him diagnosed back in the 1990s because, again, like I said, the science was not mature yet on developmental disorders, especially autism. Back then they were really pairing autism with other types of developmental disorders, like, we don't no longer say, but like cognitive impairment, what they used to call mental retardation back in the day. That's how they used to look at children with autism. I'm so happy that now, like, the science is mature and they're actually helping parents understand, like, okay, here's the issue that your child has. These are the behavior parts. These are cognitive parts. And, these are the psychological parts, because that's what autism is. Autism is like a mixed bowl of different things that are different around about the brain. I don't want to say that are wrong, because there's a lot of children and people with autism spectrum disorder who are very intelligent, very successful, and can do so much in their lives. So I can't say that something's wrong with the brain. They're just very different. And it takes time to really understand and tap into, what's really happening with them. For the most part, my son, he is definitely different. He's really just a wonderful and affectionate boy. He loves his family. He knows what love is. The hardest part with his autism is that he is nonverbal. He cannot speak. He can mimic certain words, but the wonderful thing is that he understands everything that we say. And
Wow.
and he picks up on emotional cues as well. He reacts when people are upset. He reacts when people are sad, and he also reacts when people are happy. And that's a big challenge with children with autism, because sometimes what a lot of scientists will say is that their emotional center is off, right? Like, they don't understand, some children don't understand sadness, happiness. But I don't believe that to be true. I've been fortunate to have the experience to meet a lot of children like my son, through, parent groups and school groups and everything. And I just found that these children are just phenomenal. They can do everything that we do. They just express themselves a little bit differently, or sometimes they just hold back, right? Things that where we, emotions and things that we easily show may not come so naturally.
Mhm.
And
So
yeah.
did Jalen go to school?
Yeah, so we got Jalen diagnosed before he was 2 years old, which was really an advantage. So we got him quickly enrolled in early intervention when we lived in New York. And so we actually had him in school for part of the day. And then through the New York City program, he actually had someone come in our home, and this person would do different therapies with him, different learning exercises and stuff for about an hour, 1 or 2 hours a day. So we really tackled his education very early on. We moved to Baltimore in the year of 2000. Both my husband and I, we were from New York, lived in New York all whole lives. We moved to Baltimore in the year 2000 because we found out about Kennedy Krieger, Johns Hopkins, and we really wanted to surround him with services that would really help him grow, which was the best thing we could have done, because the state of Maryland had an autism waiver program where it didn't matter your income, your social status, or whatever. The state of Maryland will automatically give your child a Medicaid card. And with this Medicaid card, you could use that to pay for speech therapy, occupational therapy. And this was wonderful because back in New York, the services weren't so affordable. The services that we got that was state funded was very limited. And everything else that they offered, we could not afford as a family. So moving to Maryland really helped us get the services he needed. He was getting about 20 hours a week rather than the 1 or 2 hours a week. And the state was able to pay for that. If we had to pay for that out of pocket, we would not have been able to afford it, because when we looked at the price, like the cost of these services, it was more than both of our salaries. So it was really interesting, back then, how services weren't allocated to everyone. So we were really fortunate moving to Maryland. He started pre-K in Maryland, and he was in a special pre-K program. He had what they call an IEP, which is an individualized education plan. And so we had to review that about twice a year, meet with all the specialists who were employed with the school, speech therapists, occupational therapists, developmental psychologists, and the special education teacher. And so, so that was a comfort, to have all of those resources. But at the same time, as the years went by, it was also the root of fatigue for our family as well. And what I want to say about that is it's wonderful to get so many services, and we were so grateful. But the work that we have to put in to keep these services going can also be exhausting for the family. Reading plans, these IEP plans, especially for my son, because he's very severe, he met every single need. Sometimes his IEP plan could be about 25 pages. And, so think about that. You're parenting, and by then we already had a third child. So, parenting three children, keeping a full-time job, trying to run a household, and then making time for these meetings, making time to read all of this, the IEP plans, and at the same time, just trying to do your own little like research on the side, trying to keep up with like, okay, what's new about autism? What are some services? What are some community services? And again, we felt wealthy in a way of resources, right? There's a wealth of resources, but also kind of bogged down like, wow, this is a lot of work. My goodness. And, so those are and I think a lot of parents who experience the same thing might understand where I'm coming from. Totally grateful, but also at times pretty tired because it takes so much work to keep his education going, to keep his services going, and not to mention the deficits that he had at home. My son was not toilet trained until he was a little bit older. So, still changing diapers and pull-ups and, changing sheets at night because he had wet the bed, things like, so even those, like, a lot of people don't talk about that, and I speak openly about it, but, it's just those housekeeping parts of raising a child with a disability can be emotionally taxing for the family as well.
I'm sure. And I commend you for exploring all the resources for your child, because a lot of parents that have children with special needs, sometimes there is that stigma, and they are a bit ashamed and they don't do the work. And as a result, the kid doesn't progress at all. So I
Yeah.
commend you for that.
Oh,
But
thank you.
you talked about potty training. So what was that like with your son? Because he's nonverbal and, severe in the spectrum.
Yeah, it was definitely a challenge. My son, toileting obviously was not a priority for him. It was a priority for me. And that's the struggle. When you have a child who you just want them to be able to toilet every couple of hours, keep them dry, keep them clean. He didn't care. He didn't, and him, with his autism, hygiene was not like he loved taking showers, but it's not something that he would initiate on his own. Hygiene was not a priority. His priority was pretty much eating. He loved to eat, and he still does love to eat. And so, his priority was really kind of like following his brother around. He had an older brother, my oldest son, Chris, and so these are the things that are important to him. So for him, it didn't bother him if he wet himself or soiled himself. You know, so that's what makes it tough, because if you're trying to teach a child with autism something that's not important to them, then they may not engage. And that's what I feel what made it a big challenge. And we would always wash his hands for him. We did what they call hand over hand, right? So with children with disabilities, if they don't initiate something, you put your hand over theirs and you help them do it. We did hand over hand washing for years. And it wasn't until he was 8 years old that he learned how to wash his hands on his own. And that was a big triumph for our family. Like I probably cried. And I just said, the day that I said, Jay, go wash your hands. And he actually went to the sink, used the soap, washed his hands, rinsed his hands, and then dried his hands. Took 8 years. So, so for a parent with a child like Jalen, any little step that he takes, putting on his shoes by himself, putting on his shirt on his own, that's a big, big victory for us. It is.
Was getting him to walk a challenge?
Not at all. So Jalen has no physical limitations. He walks, runs, he can ride a bike, he can even, he loves a scooter. Every Christmas, every couple of Christmases, we would buy him a new scooter, upgrade him. And he loved to scoot around. And he actually, luckily, the way my house was, it was an open floor plan. And the days that he couldn't go outside in the winter, he would scoot around the house, scoot around the kit between the kitchen, the living room, and the dining room, because it was like a little hall, like a little circular way for him to do it. So I was so happy that we actually, the house that we bought like was perfect for him, where he can just kind of stretch and do whatever he wanted. And so physically, he had no limitations. He loves to run, jump, just like any other kid. He walked at 10 and a half months. And so he walked very early on. He sat up early. So that's what was difficult, because none of his delays were physical. None of them are very obvious, which I can go into another conversation. Is it's hard when you take it. So for example, if I took him to the mall, he looked like, he'd stand up straight, and he looked like just a, what you would call, I guess, like a regular kid without a disability. So, and it wasn't until he acted out then you recognize that something was, wrong, different about him. And so I always found myself apologizing to people when he acted out in public, because, and they'd say, well, he doesn't look like he has a disability. And I'm like, I know, but it's clear, he clearly does. And so I think what the public doesn't understand, and maybe they do now, like with the internet and all that, I'm talking back in the 90s, early 2000s, when people didn't have the same access to information and you had to explain things a little bit more. The awareness of autism was really low. And so a lot of people used to think that, children with autism, also had physical disabilities, but many of them do not. And so it's very difficult to kind of like understand, like, why is this kid, falling on the floor and, having a, tantrum and or doing this and that, because they would just think, oh, he's such a bad kid. And it's like, nah, he's not bad. He's having what you call a straight out meltdown. And with a child with autism, when they have a meltdown, it's different than a kid who is like 2 years old having a tantrum. It could last for a long time. And half the time they look like they're too big to have a tantrum. They might be 10 years old, they might be 12 years old. And you're just kind of like just standing out like, wow, like, I don't know what to do. This is strange. People are looking at me and I don't know how to explain what is happening. So it's really confusing when they don't have that visible disability.
I see.
Yeah. We call it, I know when I teach my students in Hopkins, we call it, what do we say? Like invisible disabilities. And invisible disabilities are people with, psychological disorders, behavioral problems, things that you just can't see, depression, you can't always see schizophrenia. So autism is similar to that. It's an invisible disability for many people.
Do you think that your nursing background helped you in any way with dealing with your son?
A little bit, not as much as I thought it would. And the reason why I'm saying that is because when it's really interesting how I turn off nursing. I love nursing. I've been a nurse for 22 years, my whole life, most of my adult life. But when I'm with my children, my nursing hat falls off. I'm just a mom. And I want to be that, yeah, my knowledge helps me. So when like doctors are talking to me, I do understand a little bit more. I'm like, oh yeah, I know what that means. Oh, I know that drug, but at the same time, emotionally, I'm not the parent that walks into the hospital or the clinic and be like, I'm a nurse, here's what I want for my kid. I don't know how to do that. I just know how to be a mom. So an example of that is when my oldest son had appendicitis, and he had an emergency surgery to get his appendix removed. I was so emotionally distraught that everything they were telling me, I was just like learning it. It's almost like I never knew it, because I was a mom. And this is the reason why they don't let doctors operate on their family members. I read that scientifically, when you love someone, a lot of your emotional senses take over, and the knowledge kind of slips away. So you don't want a doctor, like let's say if your brother is a surgeon, you don't want your brother to operate on you, because if something's going wrong, his emotional senses are going to come in and say, oh, my sister, I love her. I don't want her to die. And his knowledge of all the surgery that he's done kind of slips through the cracks. So that's how it was for me as a mom. my knowledge helped me, I think, a lot. It really did. But in times of like emotional turmoil, when my back was against the wall with him, um, I just didn't know how to be a nurse anymore. I just wanted to be his mama.
So you mentioned taking him to the mall. Uh, did you take him to other outings, and were people, let's say, your friends and family, wondering why you did this?
Oh my gosh, Tanya, I'm just laughing because, yeah, that's a really good question because that's exactly what I experienced. I took Jalen everywhere, and my family would say, "Why are you taking him? You need to keep him home. He's acting out." And I just, it was weird because I would take him to amusement parks, which he actually liked. But then if he got tired, he would fall on the floor, things like that. So I just wanted him to be, try to normalize him as much as possible. And my family didn't always agree with that, and they would say, sometimes you need to leave him home. Some places are not for him. And they partially were right because sometimes what I learned over the years is forcing him into a normal life was probably, sometimes it was good for him because he enjoyed himself. Like he loves the beach, he loves the pool, he loved that, but he didn't love everything that I exposed him to. And as he became a teenager, I started to recognize like, I need to leave him home for this particular outing because this outing stresses him out. But early on, when he was much younger, I just wanted to normalize him so badly, which really was not the best thing to do. It took me many years to start learning about the best places to take him because it really wasn't about, oh, I want him to have fun. If he's not having fun, he's miserable. And I needed to recognize that and say, okay, he doesn't like this place. This makes him uncomfortable. This is overwhelming for him. So let me see if I can keep him home with his behavior support person. But it took me many years to start figuring that out because I had this dream of him. He had an older brother and a younger sister. I had a dream of all three of my children always being together. Like, oh, let's go to the zoo. All, taking all three of y'all. Because that's how I grew up. I grew up the youngest of five siblings. And, we just wanted to always be together and do things together. And that's how I wanted to raise my children. But by the time he was about 11 or 12, the reality hit me. And I recognized like, that's nice and all, but it doesn't work for everywhere. And I needed to know when to leave him home. But it took time. Yeah. So that was pretty painful too. It was hard. It was hard.
So are there drugs involved that the doctors prescribe to help maybe with anxiety or anything like that?
Absolutely. He's on a lot of medicines now. Now that he's older, when he was young, he'd probably be on like one or two meds. Typically back then, they would start him on ADHD meds because he was very hyperactive. My son does a lot of, when he was younger, he does a lot of what they call stimming. Stimming is a slang word in autism, in the autism world. It's short for self-stimulation. And you might notice this, Tanya, if you've ever seen an autistic kid go like this all the time or play with their fingers, And so my son was very bouncy, very lively, very happy, go lucky little kid. But he, jump on the couch, jump off of things, and stuff. And it was hard to slow him down. The only time he'd really sit down is like, oh, time to eat. He's like, oh, yeah. And goes, but while he's eating, he's rocking, and he's rocking back and forth because this self-stimulation just made him feel comfortable. And we recognized that. We didn't want to take that away from him. But at the same time, he wasn't always functional. It's hard to get his attention if he's constantly rocking and not listening. So we started him on an ADHD med back then, probably around age 7 or 8. And that really helped him where he was rocking a little bit less, but still doing his self-stimulation that made him happy. So we found a little bit of balance, but still there were many, many challenges because his attention span was still very short. But when he became, so ADHD meds for the most of the childhood, by the time he became a teenager, that's where we had a lot of challenges because hormones kick in. Any teenager who doesn't have autism can be a challenge, right? So imagine adding the teenage challenges on top of not being verbal and not being able to really express himself. That really caused an issue. And he started becoming a little aggressive with us. And so we had to add some more medications when he was a teenager. And some of these meds, one of them was an antipsychotic medication. because what we recognize is that sometimes when he was aggressive, he was like, really just in kind of a state of psychosis. Um, what people, and I don't want to generalize the population of children with autism spectrum disorder because they're all very different. But what I find is those who are quite severe, typically as they grow into adulthood, they develop a little bit more like mood disorders. So my son was diagnosed with mood disorder by the time he was about 15. And that's where they had to add in these medications because the mood disorder, the way they diagnosed it was he clearly did not have control over his moods. He would go from happy to sad to violent, and so that was a big challenge for us and something we had to accept. So he's still on some mood stabilizers right now, which actually work really well in adulthood. He's much calmer, much less upset. Just very grounded now, which I'm really happy about.
So if there's a parent out there that has recently received a diagnosis of autism, nonverbal, what would you say to them to sort of help them understand that they have to get resources and, you know, and the balance of everything? And what would you say?
Yeah, I would just tell them to listen to their child. Children who are nonverbal with autism, no matter what age, they could actually communicate very well. Their nonverbal cues are strong. And that's something that we learned with our son. Each and every one of us, my husband and my other two children, we understand him. And it takes years, but you just have to look at them. You got to listen to them. You got to watch them because there's still a person inside there. Just because they can't speak doesn't mean they can't express themselves. So those nonverbal cues are really, really important. And to really just hone into that and not so much focus on the verbal communication that's missing, but focus on the nonverbal communication that is so strong. The other thing I would say is take advantage of every resource, even if it makes you feel tired. You can take a break. If you have a partner, you and your partner can take turns in different meetings, different phone calls. If you're a single parent, it's hard. It's definitely hard. But I would say, pull in your allies, your family, your friends, people. But the resources are important. I would say, don't refuse them. Um, and don't convince yourself that your child doesn't need them because they do. Even if the child seems to be getting better very quickly, which I'd love to see, they still need that support for a little while. So I would say just take advantage of every resource, but take care of yourself. Take a deep breath every now and then. Make sure you sleep okay at night. That's important. It's okay to take a break. It's okay to hand them off or your child off to someone else for a couple of hours just so you could take a hot bath, and don't feel like you have to be there every single minute. It's okay to just pull back and take care of you because you can't, I know it sounds cliche, but you can't pour from an empty cup. You cannot. And I've had an empty cup many times in my life and I learned some hard lessons. So I had to really, learn how to just take a step back and let other people help me out or just take a break.
What about when they're facing or when they're feeling ashamed or, experiencing that stigma?
Yeah,
Um, what would you say?
I would say, you know what? When you feel ashamed, it's because other people have a problem, not you. You don't have a problem with your child having autism. Obviously, you want them to be better, and you didn't wish for this, but shame comes from other people making you feel bad about your situation, and that's not fair because most of the time it's people who don't have their situations in order, and these are the people that you have to remove from your life because you have to focus on your child. And I had to remove some people out of my life and people who I really, really loved. And so that was a challenge for me, but you're already challenged with so much. The last thing you need is negativity from other people who don't understand your journey. And if they're not ready to hop on that journey with you and help you, then maybe they don't need to be in your circle. And so I've lost a lot of people along the way as far as relationships. I've lost a lot of relationships because of my son, and I have no regrets because I have to love him. I have to understand him. I have to fight with him. Um, there should never be a stigma, because this is something that you didn't ask for, the child didn't ask for. It's nobody's fault. Child does not get autism because of a birth defect or something that the mom did wrong in pregnancy. It's none of those. It's nobody's fault. And people should not, if people judge, then they need to just be away from you. That's just how I managed everything.
So is special needs the correct term when referring to your son or people with disorders like this? What is the politically correct term to, say without being,
I think it's nice to ask each individual parent because everybody has a different way of how they want their child to be addressed. Some parents, feel like, they don't want their child to be labeled. I'm fine with it. Fine with saying special needs. There's a new term that's politically correct that a lot of people are using is neurodiversity. So that's a new term. Don't have to use that, but really, I think it's all about asking the parent and saying, what would you, what do you consider, your child like? How do you talk about what your child has? And some parents will say autism spectrum disorder. Some parents will say, autistic. I don't like the term autistic because it's a label. I learned in this workshop that you should always put people first, right? So, for example, if someone has diabetes, you don't want to call them a diabetic because that's not who they are. Diabetes is one part of who they are, right? That diabetes does not define them. So you can say a person with diabetes, right? Put the person first, person with diabetes, not a diabetic. So instead of autistic child with autism. So I don't think it really matters how you say it. I think what matters is that you have to put the person first and not generalize them like they're part of some like crazy pool of like group of, So yeah. So yeah, just say, child with autism, child with a disability, child with neurodiversity, child with special needs. Instead of saying special needs child, just put the person first. I think most parents will appreciate their child being recognized as a person and then the disorder, instead of the disorder defining the person.
okay. I think that is a great way to wrap things up. Thank you for being so open and candid. I appreciate that. And once again, I totally commend you because I know that has to be hard work.
Most definitely hard work, but not without love. The love keeps you going. And but I really thank you for inviting me to speak with you today. It's always a pleasure to talk about my family and our experiences. And I hope that anything that I said today helps someone else just have a better understanding of this type of journey. Whether they're dealing with it firsthand or they want to support a friend or a family member who's going through it. I hope that what I said kind of helps them gain some good insight about what this looks like for some parents.
I think so. It's been very informative.
Thank you.
So that wraps another episode of On the Couch with T. I thank you for being here, Dr. Baptiste.
Thank you.
And I've been sipping on Bigelow tea today. And thank you for coming.
Thank you.
Okay.
Thank you so much.
Sure.